Now, if you've been watching previous videos, you know that I've mentioned that the APTA has yet another brainstorm. They're starting to contemplate the idea of going to a residency or fellowship after graduating PT school and making it mandatory. Just an idea I've been reading about here and there, which is just great. You already have a 4-year unrelated degree. You have a doctorate that really isn't a doctorate. It's PT school after that unrelated degree, not advanced PT school. And now you want to extend it another year for a residency. And they wonder why I'll never join the APTA. And the not so funny thing is these fellowships and residencies, from everything I keep reading, have very little difference in overall long-term outcomes when you compare someone who's been to a fellowship or a residency versus the person who hasn't. Because we all continually take continuing education courses, and if you practice what you're learning every day one-on-one, you're going to get proficient at it. And if you see multiple patients a day your entire career, you're not going to be proficient at anything except handing out exercises and taking notes. That's it. And now I can see the critique in the comments unfolding. Well, you never went to a fellowship or a residency. How do you know? Actually, I did. I went to one and left it after 3 months because it was a complete waste of my time. And after I left it, which was over 10 years ago, it really opened my eyes about what a ruse this profession actually is. Because a fellowship is supposed to be a severe advancement in skill set, like the orthopedic surgeon fellowships. Most of these new surgeons attend these and look at the outcomes we're getting now. There should be some sort of real quantifiable level of higher expertise once you come out of one of these things. You should be sitting on the mountaintop looking below at everyone else who hasn't gone to a fellowship or residency, and this was anything but. So how did I get sold on it because I should have known better? Well, I worked with a therapist who was a graduate from one of these long-time manual therapy fellowships, and he was very proficient. Of course, I was also pretty new in outpatient. I only had about 3 years in myself, and the only manual I'd really taken was a 2-week military course, which I didn't find helpful at all, on basic joint mobilizations, and I took some John Barnes. And I'm not saying the guy wasn't good, because the guy was good. He was deluded in what he thought he could do for chronic pain patients, but generally he was ethical and saw patients 101, and I think that's why he became good, not because he attended this fellowship. I think he could have gotten the same skill set by going to weekend courses. But he sold me on it, actually wrote a letter of recommendation for my entry. And I was really excited about it. I expected an academic explosion. I thought surely I'm going to elevate to guru status in the manual therapy world. And what a disappointment it was. And it's important to note that this fellowship was known to be one of the best in the country. That's what everyone kept telling me. And in the initial interview, the lady gave me red flags all over the place. I almost didn't sign on to it because I just had a bad feeling from what she was saying. But the second interview was an Australian, and we all know they're good at manual therapy. And he talked about the mentoring aspect, which really separated this fellowship from the others, according to him. So he sold me on it. I was very excited to attend and was very much looking forward to it. The fellowship consisted basically of working 28 hours in the hospital being the outpatient clinic setting. 4 of those hours were direct mentoring. Now, the Australian had sold me that the other 24 hours you'd have indirect mentoring. In other words, you'd be surrounded by the other graduates from the fellowship, some recent, some not so. And you'd have access to their knowledge base every hour you're working in the hospital as you were trying your new techniques. That was completely not true. The 24 hours outside of the direct mentoring you were basically just working as a staff therapist. Yeah, you could ask questions here and there, but basically it was just a part-time job. And as far as the direct mentoring, this was a state-run hospital with a huge amount of poor lifestyle and entitlement-driven attitude, which means half the patients didn't even show up during that 4 hours. And the ones that did, their diagnosis types weren't even related to what you were learning that week, which is how it was supposed to be set up. Now let's talk about the 8 hours worth of 2 courses that you took while you were working at the hospital. The first one, it wasn't bad. It was a joint mobilization course. It was 4 hours once a week. But there was nothing special about it. You could have gotten the same by taking the series of Maitland courses, which I did after I left the fellowship, as the fellowship was largely modeled after the Maitland philosophy. And a lot of that 4 hours was propagating of research-based evidence, which I'm not saying isn't important, but it gets to the point where it can become like a cult. There was one mini lecture where they presented a research study that showed that chronic pain patients, specifically long-term chronic pain in the hip with degenerative changes, wasn't related to obesity at all, except the laws of physics disagree with you. You talk about cult-like nonsense. But this is what high-level academics do. They like to believe they're the smartest people in the room, far beyond everyone else, and they like to believe that they're doctors too, which they are not. And that's the type of dribble that comes out of this academia-type attitude. So the joint mobilizations were okay, but a lot of their propagation, specifically with their pain science, was largely a waste of time because nobody would admit out loud that people's chronic pain was many times attributed to lifestyle and most of the time. As far as the other course, it was called Clinical Reasoning, 2 hours twice a week. It wasn't a course at all. We did research projects and basically listened to each other's projects every single 2-hour session. We had one lecture the first session and that was it. The first research project we did was a case study review. Then we sat around and listened to everyone's case study review. Then we did a statistics project. Mine was covariates. Then we sat around and listened to each other's projects once again, then went home. There was never any clinical reasoning lecture. There was never any do this, do that. What would you do for this diagnosis? What would be your first intervention? What would be your second intervention? What do you think here? What do you think there? Simply doing research projects and then listening to each other's projects and then going home. That was the course. That's not even an undergraduate course, let alone one that's supposed to be postgraduate. So the clinical research course was a complete waste of time. We had the joint mobilization course, which a lot of that was propagation of research, which was just wrong. And we could have gotten that joint mobilization technique just by going to the Maitland series of courses. As far as the direct mentoring, half the patients didn't show up. I had one good session where I thought the instructor was really on mark. The other sessions really weren't much of anything. One, because a patient that we're seeing might be a knee replacement, which wouldn't apply to what we were learning, especially when it was shoulder week. And two, outside of their own specific specialty, which was largely modeled after the Maitland philosophy, the instructors really didn't know much of anything else. They were like people who could play one sheet of music really well, but you tell them to just sit down and play, they're completely lost. We had one patient who had just undergone radiation therapy. You could see the atrophy in the shoulder. So we do all our Maitland joint mob tests, and of course none of them rang true because that's not the problem. And I looked at the instructor and I said, "What do you think?" Which I was just being polite. Here's what I thought. I thought this is a basic 101 case and we need to strengthen the shoulder girdle. She looks at me, this is a high-level mentor in the program, and says, "I don't know." They had another instructor that told one of the undergraduates during their internship not to look at scapular rhythm because that had nothing to do with shoulder pain and they were going to teach you the real way to analyze, which of course was Maitland philosophy, which is funny because Jeff Maitland would tell you to use other philosophies as well. He would say use whatever works. They didn't even know their own philosophy that well. And if they read the books, which I did 5 times in between the Maitland courses, they would see quotes from Jeff Maitland saying just that. So basically, in this awesome fellowship, we really had a couple hours of joint mobilizations that was worthwhile, and the rest of it was just a complete waste of time, largely working in the hospital, or the outpatient clinic part of the hospital. So after a month of this, I knew I'd made a mistake. I wrote in my journal September 13th, this was a mistake. I am not learning much here. I could have gotten this elsewhere. And it was funny because we had somebody else who was a fellow candidate. He quit during the orientation in July after staying about a week because he smelled the rat in the cage before I did. It actually took me until mid-November before I finally left because I was waiting for it to get better. I was hoping it was going to get better. And then finally I realized that this whole fellowship was nothing more than a gigantic check the block. And remember, this was known to be one of the better ones, if not the best one. I mean, how do you call something a postgraduate course when all you're doing is listening to each other's projects one after another for the whole semester? That and a couple hours mentoring during the week, the indirect mentoring was non-existent. Now, I'm not against fellowships or residencies. As a matter of fact, For people who really want to advance their skill set, it would be a fine thing to do if this was legitimate, which nothing is in physical therapy. Just like your doctorate is not a legitimate doctorate. Feel free to see my other video explaining exactly concretely why, what you do versus what a graduate student does. But if you're going to have a fellowship, it should be a highly skilled curriculum. It shouldn't be just you working in the outpatient clinic with a few hours of mentoring and taking a couple courses, one which wasn't even a course at all. And that's the problem with our profession. Everything is just a ruse today. And why is the APTA pushing this? Because the APTA wants to present this idea that, look at us, we're specialty doctors too. We engage in residencies, we engage in fellowships, just like doctors. No, you don't. What you do is a gigantic check the block. And it's done nothing but to continue to fuel my anger towards this profession. So here's my advice to all the younger therapists who may consider this. First of all, if you haven't gotten accepted into PT school, my advice is not to go. And if they actually mandate going to residencies after PT school, definitely do not attend. But understand, if you want to go to this because you want to advance your skill set, which is a noble idea, you're going to be greatly disappointed, or you're going to live in delusion, just like all the fellows at this prior fellowship I attended over 10 years ago. Because I went and took the series of Maitland courses over a couple years right after I left this fellowship, and I read the books in between during every one of the 5 courses, and it was amazing to me how much their fellows actually missed. So that's my point to the younger therapists out there. If you're working with patients one-on-one and you want to become great, continue to go to continuing ed and practice with your patients one-on-one. Ignore the APTA and their grand ideas of going to these fellowships for reduced pay. You already have about $150,000 in debt on average, and if you're paying the monthly minimum, that's going to be about $250,000 by the time it's all said and done. This thing was a complete waste of my time. I'm not sorry I left at 3 months. My only regret is I wish I had left earlier. It was a ruse. The fellows there live in arrogant delusion with enormous egos that are off the chart, and you certainly don't need something like this to become a proficient physical therapist. What you need is the ethics of practicing one-on-one with your continuing education, and the rest will take care of itself.